Hi, I'm Dr. Akhtar from MyMSK clinic. Today we're going to talk about tennis elbow. What is tennis elbow? Well, the medical term for tennis elbow is lateral epicondylitis, and it refers to inflammation and degeneration of one of the extensor tendons on the elbow here. This commonly presents with pain in the elbow when twisting, bending or pushing. Okay, now what I'm going to demonstrate next is how we scan for tennis elbow. So it's important that we do an ultrasound scan on the elbow to first confirm tennis elbow before we can do any treatment. I'm now going to scan the patient to see if he actually has tennis elbow. Scanning is done with the elbow flexed, and what we're doing is scanning the insertion of the extensor carpi radialis brevis tendon, and we go through the tendon like this, and we'll ask him just to put his thumb up. That often brings out the tendon, and we're looking at its attachment on the elbow lateral epicondyle. I'm going to actually scan my own elbow because I've suffered from tennis elbow in the past, and as I scan it we can actually see resolving tennis elbow with some ERCB tendon degeneration on the lateral epicondyle. I will freeze that and talk you through the process. Just to talk through the changes on tennis elbow, we can see some tendon degeneration on the attachment of the extensor tendon onto the actual lateral epicondyle. So how do we treat tennis elbow? Well, there's several approaches. One is physiotherapy, strengthening the actual extensor tendons, and the other is injections. When it comes to injections, we normally start with either a cortisone injection under image guidance, or we sometimes do PRP. PRP has shown good effectiveness, but it doesn't give immediate pain relief. Cortisone tends to give immediate pain relief, but in the long term, PRP is probably better. We also have autologous blood and prolotherapy.